Hi everyone, Dr. Skora here from Fertility Specialists of Texas. I'm here to talk to you today about all the different aspects of IVF and their safety. Through your journey, there will be several people involved in the journey. The first person is the egg donor. The question about egg donor safety is, does this hurt the egg donor in some way or another? A lot of people worry about the fact that the egg donor is using all their eggs to go through IVF to make eggs for me. That isn't the case. Every month, a woman's ovaries produce a group of eggs, and the brain normally tells one of those to grow and ovulate. The rest of the eggs from that month normally just die away. So in reality, a woman loses hundreds of eggs per month, not just one. What we do in IVF is we collect as many eggs as we can that were available from that 1 month. So in essence, we're not really affecting the overall pool of eggs for that egg donor in the future. The actual retrieval of eggs from the egg donor does carry with it a very small risk, less than 1%. Whenever I put a needle through the vaginal wall into the abdomen, there's always a risk of bleeding, infection, need for emergency surgery, and blood transfusion. But those are all very, very rare and less than 1% of the time. The other question that I sometimes get asked about people who go through IVF is, does it increase their risk of cancer in the future, specifically ovarian cancer? Many studies have been done looking at this, and the majority of them have said that doing IVF itself does not increase the risk of future ovarian cancer. The reality is that most people who do IVF are infertile, and because of that infertility diagnosis, there's an increased risk of cancer future life. The next person involved in your journey is a gestational carrier. And there are some safety aspects to the gestational carrier process as well. Pregnancy in general can be an unsafe process. Gestational carriers are screened to make sure that they are good candidates that have very, very low risk of having bad outcomes when it comes to becoming pregnant and having a baby. But we will talk about any of those things about your specific gestational carrier, whether there's an issue that we are concerned about that might increase risk for that gestational carrier. The last person that you might be interested in whether IVF is safe about is your eventual child. People worry that IVF and all the processes that we do lead to children that have problems. Yes, children of IVF do have a 1% increased risk of deformations compared to the general population. The general population risk is 3%, so up to 4% of having a child with some sort of problem. Any problem, no specific problem. It could be anything from an abnormality in the heart to something completely benign, a penile problem, all different kinds of issues. The majority of those cases, though, are found in people also, again, who have infertility of some form or another. So most of the time, when we're dealing with a same-sex male couple or a single male, there are no actual medical problems leading to infertility. And so this does not really apply to your case.